Welcome to NGN-NCLEX High Yield Questions, the NCLEX Solution Hub. Are you ready to pass the NCLEX with confidence? You're in the right place. This channel is designed to help you master the next generation NCLEX, NGN, through high-yield, exam-focused questions that train your clinical judgment, not just memorization. Each video presents carefully crafted scenarios that reflects real NCLEX-style cases, helping you think like a nurse and apply concepts in real-life situations. What makes NGN different? The new NCLEX focuses on your ability to recognize cues, analyze and prioritize patient needs, generate solutions, evaluate outcomes. The nurse gathers data from a client with Cushing syndrome. Which of the following client statements are consistent with Cushing syndrome? Select all that apply. 1. I am no longer able to fasten my favorite pair of jeans. 2. I am self-conscious about the purple stretch marks on my breasts and belly. 3. I have noticed I have less hair on my arms. 4. My face is getting so round it is hard to find a hairstyle that looks good. 5. My skin seems thinner and bruises more easily than it used to. The nurse is providing teaching to a prenatal client about the 1-hour glucose challenge test that will be performed at the next visit. Which client statement indicates a need for further teaching? Fasting is required before the 1-hour glucose challenge test. 1 blood sample is obtained at the end of the test. The test includes drinking a 50-gram glucose solution. The test's purpose is to screen for gestational diabetes, not diagnose it. Is caring for a preschool-age child whose grandparent died 3 days ago. Which intervention is appropriate? 1. Assign the same nurses and caregivers to the child each day. 2. Avoid mentioning the loved one's death in the child's presence. 3. Explain the importance of being with the child to the parents. 4. Schedule time each day for age-appropriate play. Just joined the football team. Which of the following actions are appropriate for the nurse to include during the discussion? Select all that apply. 1. Advise participation in a different, less strenuous sport. 2. Ask the client to demonstrate use of the inhaler. 3. Describe methods to warm inspired air during cold weather. 4. Recommend using the inhaler 15 to 30 minutes before exercise. 5. Reinforce that the inhaler is for personal use only. Are appropriate for the child to perform. Select all that apply. 1. Choose insulin injection site with parental oversight of rotation schedule. 2. Push plunger of insulin syringe after a parent inserts and stabilizes the needle. 3. Select and clean the site for fingerstick blood glucose testing. 4. Use a chart to determine insulin dose based on glucometer reading. 5. Verbalizes 2 or 3 signs and symptoms of hypoglycemia. A nurse is participating in an obstetrical emergency simulation in which the healthcare provider announces a shoulder dystocia. As the assisting nurse, which of the following interventions should the nurse implement? Select all that apply. 1. Document the time the fetal head was born. 2. Flex the client's legs back against the abdomen and apply downward pressure above the symphysis pubis. 3. Prepare for a forceps-assisted birth. 4. Provide newborn suction bulb to the healthcare provider for suctioning fetal mouth and nose. 5. Request additional assistance from other nurses immediately. A 1-year-old child who goes to daycare is recovering from an episode of otitis media. Which intervention is most important for the nurse to recommend to the parents in order to prevent recurrence? 1. Exclusive breastfeeding. 2. Not sending the child to daycare. 3. Preventing water from entering the ear. 4. Smoking cessation by the parents. Patient in the emergency department develops severe airway obstruction following facial trauma. The nurse notes stridor, use of accessory muscles, and decreasing oxygen saturation despite oxygen therapy. The provider prepares for a cricothyroidotomy. Which of the following is the priority nursing action? 1. Prepare the patient for endotracheal intubation. 2. Assist in identifying the cricothyroid membrane. 3. Administer a sedative as prescribed. 4. Position the patient in high Fowler's position. Is assisting with an emergency cricothyroidotomy on a patient with complete airway obstruction. Which of the following are appropriate nursing actions? Select all that apply. 1. Hyperextend the patient's neck if no cervical S-pants injury is suspected. 2. Palpate and identify the cricothyroid membrane. 3. Delay the procedure until consent is obtained. 4. Prepare sterile equipment for incision. 5. Continuously monitor oxygen saturation. 6. Provide oral fluids after the procedure. A nurse is caring for a patient admitted for methamphetamine withdrawal. Which of the following signs and symptoms should the nurse expect? Select all that apply. 1. Depression. 2. Increased energy. 3. Hypersomnia, excessive sleeping. 4. Increased appetite. 5. Agitation. 6. Euphoria. Please like and subscribe. Thank you.